Hey guys, how you doing? Dr. Shaun here. Hope everyone's doing well today. Well, today I'm going to be talking about how to choose the right anesthesia for your patient. So the type of anesthesia your dentist will usually suggest is based on the type of procedure and the patient's medical history. So longer procedures, more invasive types of procedures like oral surgery, even gum grafts and perio surgery sometimes require a heavier anesthetic. And smaller, less time-consuming procedures like fillings and bondings may require only a local anesthetic that covers a small portion of that mouth. So for longer procedures, we tend to use blocks of anesthesia, and for smaller procedures, we tend to do like local infiltration. Now, also the medical history is going to affect the choice of anesthetic. Some anesthetics can have a higher risk of side effects for patients, especially with pregnancy, high blood pressure, and other medical issues. So we have to take into consideration not only the type and length of the procedure, but also the patient's medical history. Now, in my office, we mainly and probably solely use local anesthesia. So I'll talk about today the different types of anesthesia that are used. And before I talk about that, obviously one of the choices of anesthesia is no anesthesia. So if there's a small decay or a fraction or abrasion, you can have the option of actually giving your patient no anesthetic. Now let's talk about the anesthetics. Now the first anesthetic is called Lidocaine with epinephrine. So this is a very common anesthetic. It's powerful, it's long-lasting, it lasts about 2 hours, but it can't be used with patients who have conditions that are not allowed the use of epinephrine, so such as patients with high blood pressure or other heart issues. Okay, so you got to take that into the consideration as well. So the second anesthetic is Arcane with epinephrine. Now this is also very powerful and long-lasting, so it lasts about 2 to 4 hours, but it also can't be used with patients that have contraindications with the use of epinephrine. And this anesthetic has a very rapid onset and efficiency. I would say I actually use this anesthetic more than any other anesthetic, just because it's fast-acting and it tends to not last as long as the lidocaine, so this is one I really like. The third anesthetic is Lidocaine without epinephrine. So we use these for patients that have high blood pressure, glaucoma, pregnant women, patients taking medications that interact with epinephrine, and just patients in general that have a sensitivity to epinephrine, okay? But the problem with this anesthetic is that it is not long-acting because it doesn't have any epinephrine. But the plus side, it doesn't raise your blood pressure or have any side effects that epinephrine does. The last anesthetic used is called Arcane. Now this is a very long-lasting anesthetic. It's used primarily to provide a sustained pain relief after any sort of extractions or really big surgeries. It can last about 12 hours after administration. So those are my 4 types of anesthesias, local anesthetics. Other types of anesthetics that I'm not going to talk to today, maybe I'll talk about another time, is just regular sedation and general anesthesia, which I don't personally do, but I have specialists that obviously use those types of anesthetics. Well, there you have it. There's a little bit more information about the different types of anesthesias used in dental offices. If you have any questions, please let us know. Have a great day, guys.